Acute stress disorder and everything about it. Life is a very interesting thing and sending us everyday gifts. Sometimes pleasant and enjoyable, but sometimes disgusting and desired and even with a terrifying experiencing. So many days after experiencing a life-threatening, terrifying, or otherwise deeply traumatic event, may in some cases, depends on your reaction of course to the process, develop acute stress disorder, or sometimes call it acute stress reaction. By definition, it is characterized by severe anxiety symptoms and follows a certain event that causes feelings of fear, helplessness, and horror. Anxiety should last less than 1 month and greater than 3 days to be classified as a diagnosis of acute stress disorder. Causes that precede the acute stress disorder are natural disasters like floods, fires, and earthquakes, physical or sexual assault, car accident, loss of any kind of object or loved one, sudden death of a loved one, and receiving a life-threatening diagnosis like a cancer. Risk factors. Not everyone who experiences trauma, any type of trauma, will develop acute stress disorder. A number of factors may increase the risk of a person developing this condition, and them include being a female, history of trauma, or history of mental health conditions, the severity of a traumatic event, and neurotic personality traits. Here we have symptoms, physical and psychological. People who are affected by acute stress disorder tend to experience extreme feeling of terror and helplessness in reaction to trauma and may develop psychological and physical symptoms. The physical symptoms are typically caused by stress hormone such as adrenaline and an increased or overactivity of the central nervous system. These symptoms usually develop within minutes or hours of the traumatic event and may clear within a few hours or days. However, in some cases, the symptoms persist for weeks. Psychological symptoms are of five main symptoms like arousal, avoidance, dissociation, intrusion, and negative mood. Let's talk about every in part, like arousal represent hypervigilance and inability to focus, sleep disturbances, and irritable mood. You are angry. Avoidance, determination to avoid memories, people, and feelings that are associated, of course, with trauma. Dissociation, a sense of physical displacement. Seeing oneself from outside one's body, feeling dazed, experiencing an altered perception of time, and difficulty to remember some events. Intrusion is recurrent involuntary flashbacks. Negative mood, a generalized low mood, difficulty feeling or experiencing positive emotions. And physical symptoms like increasing heart rate, chest pain, headache, stomach rashes, nausea, and sweating. To diagnose acute stress disorder, we are using DSM-5. DSM-5 diagnostic criteria, which are American Association Diagnostic and Statistical Manual of Mental Disorders. It's a fifth edition, and we are using to diagnose. So, 5 components: exposure to actual or threatened death, serious injury, or sexual violation. In addition to direct witnessing or experiencing a traumatic and event, it is possible for a person to be affected by acute stress disorder if the patient learns that a traumatic event happened to a close relative or friend, or are exposed to traumatic event as part of their job. Second one is presenting symptoms of the 5 categories. It's the second of the 5 categories of symptoms for acute stress disorder: intrusion, negative mood, negative dissociation, avoidance, and arousal. As we see them: arousal, avoidance, dissociation, intrusion, and negative mood. Who are affected by acute stress disorder or present at least 9 of the 14 symptoms from any of the categories, from physical or from psychological. This list can be completed with a lot of symptoms. A third one is duration of the disturbance. So symptoms must last at least 3 days, as I told you, to 1 month after the traumatic event took place. And significant distress, where symptoms are debilitating enough to impact the person's usual way of life, such as through impaired performance at work or the ability to participate normally in social activities. And ruling out other causes, ruling out physical conditions such as brain tumor or any injury to the head or other psychological condition. And also taking in account if the condition isn't attributed to the effects of any substances such as medication or alcohol. And last line represent treatment. Psychotherapy, medication are the main and important things that are used. But the most important one represent psychotherapy. While there are many different types of psychotherapy, trauma-focused cognitive behavioral therapy is the most one recommended for the treatment of acute stress disorder. Timely course has been proven to reduce the likelihood of acute stress disorder developing into post-traumatic disorder, which is the same thing, only have more than 1 month of symptoms. More than 1 month of symptoms. And it is usually initiated no sooner than 2 weeks after the traumatic event. After 2 weeks, of the traumatic event, and with 6 weekly sessions of 60 to 90 minutes. So medication is not a first line here. Treatment for acute stress disorder. Psychotherapy is useful and have good results. If recommended at all, benzodiazepines such as clonazepam will typically be used only in low doses for the short term to relieve the severity of anxiety and arousal symptoms. Also, beta blockers, non-selective, can be used for this process. But the most important and with some improvement represent psychotherapy. Trauma-focused cognitive behavioral therapy. Thank you very much and have a good time, guys.